This video went viral on the 3rd of October 2022 when some guys were playing football on a field somewhere in Lagos. Sorry, I had to blur the video. Along the line, one of them slumped and died. You can see from the video that these people wasted a lot of time. No one called for an ambulance or even managed to transport him to the hospital immediately, and none of them knew how to perform CPR. What that other guy did was to keep calling his name, and of course he was unconscious, so he couldn't answer. This guy was confirmed dead by the doctor by the time they arrived at the hospital. Most times when people slump while playing football is as a result of cardiac arrest, and a simple and effective CPR can sustain their lives until they arrive at the hospital. Remember from my last video, I mentioned that anybody can perform CPR, which is true. You don't have to be a medical personnel to be able to perform CPR. So please watch this video until the end as I guide you on what to do if you ever find yourself in such a situation. CPR, short for cardiopulmonary resuscitation. It's a life-saving technique. It aims to keep blood and oxygen flowing through the body when a person's heart and breathing has stopped. When the heart stops beating, permanent brain damage begins after 4 minutes, and also without oxygen, death can occur as soon as 4 to 6 minutes after the heart stops beating. The heart might stop beating after a cardiac arrest that might be as a result of an electric shock, drowning, playing football, working out, and a heart attack. Yes, heart attack. You might ask why I mentioned heart attack. Heart attack occurs when blood flow to the heart is blocked, but the difference is that during a heart attack, the person is still conscious, but might soon become unconscious and go into a cardiac arrest if not taken to the hospital. CPR. C stands for cardio, which is the heart. P stands for pulmonary, which is the lungs. And R stands for resuscitation, which means to revive someone. And CPR involves chest compressions and rescue breathing. Chest compressions, like she's doing, keeps blood circulating around the body. Rescue breathing, like she has just done, which you have to do by breathing into the person's lungs through the mouth, provides oxygen to the lungs. Recent research suggests that chest compressions alone is enough, especially for a bystander. Bystander are people who witness a cardiac arrest and have no formal training in CPR. Before we forge ahead, there is a machine called Automated External Defibrillator. It can be found in many places and is available for home use. In advanced countries, these machines are found in public places just in case someone has a cardiac arrest, so you can run to go get one. These machines have pads which you place on the victim's chest. It checks the heart rhythm automatically and gives a sudden shock. That's if and only if that shock is needed and necessary to get the heart back into the right rhythm. It's not all about focusing on when to give CPR. You should also know when to stop CPR or circumstances that might make CPR inappropriate. Note that the sooner you start, the more the chances of survival, but that doesn't mean you have to do CPR for 3 hours or more. It's simple, but it's energy consuming. It's not something you can do for a long time if you have not had breakfast or even lunch. One is obvious sign of death. This is why it's better you start CPR as soon as you witness a cardiac arrest. If you don't witness the cardiac arrest, you might end up performing CPR on a dead person. If you find yourself in a situation whereby you just stumbled across an unresponsive victim, you must assess the person to see if starting CPR is necessary at all. You have to check if the person is cold to touch. That's if rigor mortis has set in. Rigor mortis is when the body is stiff, and dead bodies become stiff as soon as 4 hours after death. And also, livor mortis. Livor mortis refers to that bluish color you would find on someone who has been dead for several hours. You recognize livor mortis when you roll someone over. You will notice that that part he was lying on the floor with will appear bluish because blood has settled down there and then it's already permeating through the skin. And this livor mortis is a definitive sign of death. Physical fatigue is the second point. Unlike what we see in movies, CPR does not bring someone back to life after just a few chest compressions. CPR in reality can take up to 30 minutes to 1 hour 30 minutes before a person responds. Research has shown that longer CPR efforts improves brain function. CPR can be very tiring. A person burns 165 calories after only 15 minutes of CPR. In 2015, a toddler was revived after CPR of 1 hour 41 minutes. If you cannot physically continue to perform compressions, it is appropriate you stop. No one will sue you. There are no legal grounds to hold a person liable in this type of situation. Stopping CPR as a result of fatigue or tiredness is protected by what we call the Good Samaritan law. The third point is when you see signs of life, like the second clip over there. That's when there is a purposeful movement, when the person makes sound. That's not just any sound, an obvious sound like moaning, or the person speaks, or even eye movement. Don't just blinking the eyelids, but the victim has to look around. If you stop CPR and the person becomes unresponsive again, you have to resume CPR. The fourth point is when advanced help arrives. Sometimes they will request that you continue doing the compressions while they get their equipment ready. This is because stopping CPR for 10 seconds is very risky to the victim. And also, when the scene becomes unsafe, if you notice that the person is breathing, stop CPR. Keep his or her airway open and continue to monitor the person's breathing for any changes in condition while help comes. Now, how is CPR performed? There are two versions. For healthcare provider, that's those that are trained in CPR, we do 30 chest compressions to 2 breaths at a depth of at least 2 inches. 2 inches is also equivalent to 5 centimeters as seen on the screen. This is for an average adult. Then for the general public or bystanders, as seen by the right, that's just a man that was probably on his way to work and then he witnessed a guy that just slumped. So for a bystander who witnessed an adult that suddenly collapsed, you do compressions only, or what we call hands only CPR. This is without the mouth to mouth breaths. So those are the two versions we have. You are walking along the road or playing football, then someone suddenly falls and becomes unconscious. No need to be scared. First and foremost, check the scene for safety. If you fell while he was crossing the road, you don't have to rush over to him or her. You have to be sure that the scene is safe for you before you can rush over. Then shout out to the person. If you know his or her name, better call out to him or her. Tap the victim's shoulder. Ask, are you okay? If the victim is, you have to ask loudly. You have to shout. If the victim is unresponsive, you either call 911 if 911 works in your locality, or you ask a bystander to call the local emergency line, or ask someone to get a cab to quickly transport this person to the hospital. Remember, you are doing all this within few seconds. No need to waste any seconds. So place the person on their back on a firm flat surface and kneel beside them by their neck and shoulder, just as seen on the second clip. Then if there is an AED available, check the heart rhythm. The machine may also instruct you to deliver electric shock to the heart before you start chest compressions. If an AED is not available, no problem. Just start chest compressions immediately. This chest compression recreates the pumping motion of the heart so that blood circulates to the vital organs and the rest of the body with each compression. Now, with each compression, blood escapes from the heart to the rest of the body until help arrives. And also, it's very important to note that you're going to continue chest compressions even inside the cab while transporting this victim to the hospital. You are going to continue chest compressions until the medical personnel takes over. So just note, it's important to allow the chest to come back after each push. So it does not have to be too fast or too slow, just like you can see it in the picture, in the clip. The chest compressions don't have to be too fast and too slow. If the person is an adult, place the heel of one of your hand in the center of their chest, that's between the nipples. Then put your other hand on top of the first and interlock your fingers and raise them so that only the heel of your hand remains on their chest, just like she's doing on the clip. Now begin the compressions. Use the weight of your upper body to push straight down on their chest at least 2 inches. Perform this at a rate of 100 to 120 compressions per minute. That is if you are doing just the hands only compression. If you are not going to alternate with breaths, 2 breaths, you are going to do this from 100 to 120 compressions in 1 minute, and then you are going to allow the chest to recoil between compressions. Continue compressions until the person starts to breathe or medical aid arrives, or until you get to the emergency unit and help is ready. If the person begins to breathe, have him lie on his side quietly until medical assistance is on the scene. You can see that I did not mention anything about giving mouth-to-mouth breath. That is because this is for a bystander that is not skilled in CPR. The second version is for someone that is trained in CPR, someone that has undergone the CPR training. You follow the same step for the adult and teenager. Perform the chest compression, but this time around it's also 30 chest compressions. Remember, the hands only, you're not doing just 30, you are going to continue the chest compression until help arrives. But for a trained personnel, someone that is trained in CPR, you do 30 chest compressions, then you open the airway by doing the head tilt and chin lift maneuver. So you place the palm of your left hand on the person's forehead and tilt the head backwards. Then with your right hand, gently lift their chin forward with the other hand. This opens the windpipe. If you can watch the first clip where they wrote head tilt, chin lift. Then you give rescue breaths with the airway open. You pinch the nostrils shut. This makes sure that the air you are giving does not escape. Then you cover the person's mouth with your own mouth to make a seal. If you're not okay with your mouth against the victim's mouth, you can put a small cloth or a handkin over the victim's mouth. Then you cover with your own mouth, form a seal, and blow in air into their mouths. This is after you have performed the 30 chest compressions. For an infant, you know their face is small, so instead of using your hand to pinch their nostrils, you will use your mouth to cover both the infant's mouth and the nose, and then blow in air. The rescue breath should last about 1 second, meaning you have to inhale deeply before blowing in air. For an infant, there is no need to inhale deeply because of the capacity of their lungs. The air in your mouth is more than enough for the infant. Then after giving the rescue breath, you have to watch the victim's chest. So as you're giving, just watch, look at the clip as she's giving the rescue breath. You're going to see that the chest is going to rise. So with each air you blow into the lungs, the chest is going to rise. If the chest does not rise, you have to reposition the victim and blow in air again. So you will alternate 30 chest compressions with 2 rescue breaths until the person begins to breathe or until medical aid arrives. So CPR on a child is also the same process, but you have to get consent from the parents or the guardian before you start CPR. You can introduce yourself and tell the guardian that you have a little knowledge in CPR and it's better to try something than to watch his or her child die. So you follow the same procedure, but for an older and bigger child, you use both hands. But for a small child, you use only one hand to perform the chest compression at a rate of 100 to 120 compressions per minute. Also 2 inches depth. So you open the airway, give 2 breaths, watch the chest rise, allow air to exit the mouth before giving the next breath. Continue alternating 100 to 120 compressions and then to 2 rescue breaths until you see signs of life or medical aid arrives. For infants and babies, use 2 thumbs or 2 fingers to give the compressions. It's also the same procedure. You have to also take permission from the parents or guardian. You shout the baby's name if you know it, or you can tap the baby's foot. You check to see if they are breathing or not. If they are not, you call for help. Place the baby on a flat surface. Kneel or stand beside the infant. Give the 30 chest compressions. That's if you are trained. Then place both thumbs next to each other in the center if you are going to use the 2 thumbs technique. Place both thumbs next to each other in the center of the chest. Circle the rest of your fingers around the baby to provide support. Then push down on both thumbs, hard and fast, at a rate of 100 to 120 compressions per minute. And the depth this time around is going to be 1.5 inches, which is 4 cm. That's not too deep, not up to 5 cm for the adults, not up to. And also you can use 2 fingers, just like the second clip. You open the airway through the same technique, tilting the head and lifting the chin. Give 2 breaths and blow into the baby's mouth for 1 second. So guys, if you want to go through a formal training on CPR, you can go online and take some free courses. CPR works and CPR saves lives. Thank you so much for watching Trisha's Health Talk. If you loved the video, please hit the bell icon to get notified of our upcoming videos, and also like and subscribe to our YouTube channel. Thank you.